I'd like to introduce Professor Kate Tchanturia MBE from King's College London, as well as Dr. Karri Gillespie-Smith and Dr. Fiona Duffy, both from the University of Edinburgh, to tell you more about their work on transforming eating disorder care for autistic people. And instead of doing a long introduction for each of them, because we have three different people, I'd encourage each presenter to share a little bit of their background and research career as they introduce themselves ahead of speaking. So I think we're ready to start. So Kate, I think it's over to you first.
Thank you so much, Rebecca, for this kind invitation. And I'm very honored to be part of this meeting. And just a few words about myself. As Rebecca said, I'm based at King's College, working here in eating disorders for 30 years now, and lead South London and Maudsley NHS Trust Eating Disorder Specialist Service as a consultant psychologist. And before working in eating disorders, my background is in clinical and experimental psychology. And now I want to swiftly move to my presentation and tell you why I'm so grateful for this fantastic charity, Medical Research Foundation, who supported us not only for one project, but actually a couple of very important projects. And I'm very, very grateful for the support you are giving to our research to support neurodivergent community and make eating disorder service more neurodivergent friendly. Next slide, please, Karri. So I will be talking about peace pathway very briefly, and to support our listeners today, a lot more information in our website. So you can go to this website, download lots of resources we created over the years with support from research, clinical, lived experience community, and of course funders who supported us to produce this website and supporting us to add more and more free resources to make sure that people with needs who have neurodivergent conditions and have eating disorders are not left out. So to give you on the nutshell what we are trying to achieve, we all know that eating disorders are serious mental illnesses and serious mental issues, but most of the treatment, evidence-based treatments we have in the field are developed for neurotypical population. So for years, we failed to notice people with neurodivergent needs. And now it is time to bring together research evidence, clinical evidence, lived experience, and collaborate and co-produce neurodivergent friendly eating disorder pathway. And we have all these materials on the website, but again, I want to give you a bigger picture. Next slide, please, Karri. So as we thought about, we are not proposing to change all evidence-based treatment which is available out there in the field because we have good treatment interventions. What we are proposing instead to take in account communication aspects of neurodivergent conditions. And we do know that in autism and ADHD, people have certain preferences in communication. For example, during meal times, it might be counterproductive to talk to an autistic person about their hobbies, about their social preferences when they are finding quite hard to get through the meal, or to make sure that we have eye contact during the therapy sessions. So there are some small neurodivergent friendly adaptations we can easily make, and that's what we are trying in communication front. We also are trying to be more sensitive to sensory issues, because we are well aware that neurodivergent community, research shows that some people are oversensitive to sounds, textures, smells, and some people are undersensitive. And during therapy sessions or in general well-being, it is useful to be aware of sensory system and then manage these sensory sensitivities using sensory workshops, sensory toolkits, and we are doing lots of work around it. And third very important aspect, which Peace Pathway developed through our work, is to give confidence to carers and clinicians who support their loved ones in their treatment journey most efficiently. Here on the slide, you see a small graph. Before we started Peace Pathway 6 years ago, um, clinicians and multidisciplinary team had less confidence and competencies to care about neurodivergent community, specialist eating disorder service. But after series of training events, supportive materials, webinars, conferences, their confidence and competencies went up. And we are very proud of this result. Next slide, please. So what we are trying to do with support of Medical Research Foundation to implement the good practice we are trying to introduce, and also disseminate it, not only in the UK, but internationally. I'm very proud to say that 6 years ago, this neurodivergent friendly pathway was developed in London, South London, and Maudsley NHS Trust. But after 6 years, you will see after my presentation that Scottish colleagues developed very strong Scottish network, good clinical practice guidelines, fantastic work, and expanded our Peace Pathway in very interesting way. There is good work going in other parts of the country. We are founding networks and family, peace family, as it were. And since I started to monitor our website, peace website, which I mentioned in the beginning, we have for last 11 months 40,000 followers from 128 countries. And I think for 6 years, it's quite a good achievement, quite a good dissemination. We would like to do a little bit more. Next slide, please. So this is our little fragment of our wonderful collaborations and collaborative groups. In many cases, COVID was awful, but in terms of network development, it was a blessing because we moved to the online meetings more extensively. I think it facilitated lots of good collaborations, public engagement. And this event is a good example of how we can expand and spread the word even wider. Next slide, please. So key area of our co-productive work is to assess what our community needs, what main stakeholders need. And this is powerful triangle, which helped us to establish Peace Pathway. And you see in this triangle, what I put intentionally, qualitative assessments we did in my group, in my lab, to ask carers, patients, and clinicians what their needs were to develop more neurodivergent friendly clinical pathway. Next slide, please. And to put jigsaw puzzle together, on one hand, we need strong research evidence, which is generated in my experimental lab in Edinburgh University, as you will hear from my colleagues. We need needs assessment and close communication with the main stakeholders, especially with people with lived experience. Then we need co-production, and we did all these steps for the peace pathway. And the next step is implementation, dissemination, and engaging people who would like to implement this good practice in their NHS settings. So current Medical Research Foundation grant and funding pocket supports exactly that. And once again, I'm very, very grateful. Next slide, please. I think we did quite a significant work for autistic community who have eating disorder problems, but there are a lot more things to be done in ADHD front. And as we speak, my PhD student, Lauren Markin, is doing great work collecting needs assessment from lived experience people, from clinicians, and I will have new researchers starting to collect carers' accounts, what needs to be done to create ADHD-friendly pathway. Next slide, please. Having said that, lots of the resources and materials we developed are relevant for ADHD community, and this is already developed working with autistic community. I mean, environmentally friendly adaptations for neurodivergent community, reduction of noise, studying therapeutic environment in terms of sensory overload, and giving practice guidelines and many other initiatives. You will find details on the PEACE website, including PEACE menus and communication passports and many other useful resources you can start using in your own services or in your own environment. Next slide, please. Now, I would like to highlight one recent paper we produced jointly with our Scottish collaborators and Buckinghamshire collaborators who already implemented this pathway in their NHS settings. We learned a lot from early implementers and to support further dissemination and further implementation of this pathway. We produced this paper where we highlighted what they need to bear in mind when they start neurodivergent friendly pathway in their specialist eating disorder services. I think I reached my time limit here. I will stop and will be happy to answer questions after the presentation. Next slide, please. Just to acknowledge my close collaborators and some of the multidisciplinary team, and encourage you to keep calm and seek peace and follow our website. Thank you very much.
Thank you so much, Kate. That was fab. I shall keep calm and seek peace throughout this presentation. So pleased to meet you all. My name is Fiona Duffy. In terms of background, I'm a consultant clinical psychologist. So I've worked with children with eating disorders for the past 20 years. And maybe about 10 years ago, I kind of moved more into research, but continuing my clinical activity as well. And I think that was partly with regards to feeling quite frustrated about the lack of research in the field of eating disorders and wanting to do more about that could have an impact on clinical practice. So it's lovely to be able to come full circle and to begin to do some of this dissemination work or some of the research that we've been doing. So it's myself and Dr. Karri Gillespie-Smith who leads the Eating Disorder and Autism Collaborative, and I'll let Karri introduce herself. She's presenting just a little bit later. But in terms of the next slide for EDAC, in terms of, if it's okay to move on to the next one, Karri, that's for those of you who hadn't heard of us, we are the Eating Disorder and Autism Collaborative, which was an initiative which was developed a couple of years ago in response to really concerns around about a lack of research within the field of eating disorders. And as a result, there was a number of funders, including the Medical Research Foundation, which we're incredibly grateful for, which pulled together to really increase innovation and capacity within research within the field of eating disorders. And they funded a total of 4 different networks, which the networks are about building research capacity and to support kind of cross-field and interdisciplinary research. And we were delighted that we were one of those funded researchers, particularly looking at joining the field of eating disorders and autism, which have traditionally worked in silos. So we have kind of 4 different work streams that we've been working through over the past 2 years. Our first work stream was really focusing on thinking about some of the ethics surrounding some of the research around co-production within this field. The second work stream, which Karri will go on to talk about, was thinking really about using photo voice as an innovative method, which Karri will describe, to really think about the unique experiences of autistic individuals with an eating disorder. And then further work stream thinking about how do we pull together interdisciplinary research and using new innovations and new methods. And finally, the bit that I'll be talking a little bit about at the end is that full circle with regards to all this amazing research that we've been had a privilege to do. How do we actually integrate that back into clinical services and have benefit to the individuals who need it as well? So the next slide, our kind of first work stream, it was really focused on developing what we call best practice guidelines. So this was a series of workshops that we ran with a range of different individuals and producing guidelines for ethical co-production with autistic people with an eating disorder. So essentially within our research work streams, we wanted to put our best foot forward. We wanted our research to be led by autistic individuals and their priorities, and to make it really meaningful as well, to have clinical impact. So these are kind of freely available guidelines. So you can go onto our website, edacresearch.co.uk. And we've also got a range of kind of downloadable tools and worksheets that you can also use to apply to your own research, and kind of some reflective questions to help support that process as well. So Karri, if you just skip forward maybe about, as you'll see that we've managed to publish some of these and also begin to think about some of the barriers to this ethical co-production process. And really as offshoots of that as well, there was also a kind of couple of publications around about some of the ethics of research in this area, particularly some of the techniques like MRI, which we use within EDAC, and also just even beginning to think about some of the measurements that we're using as well for eating disorders. Because there's slightly difference of presentations for autistic individuals with eating disorders. And as a result, our concern is whether or not all our traditional eating disorder measures are necessarily targeting either the right mechanisms or recognising eating disorders in some individuals as well. For the next slide, I'll hand over to Karri, who'll be able to talk a little bit more about work stream 2.
Hi everybody, thanks so much for that, Fiona. So I'm Karri Gillespie-Smith. I'm a senior lecturer here at Edinburgh University. My background's in social and cognitive processing and mental health and wellbeing in autistic groups. So my background's very much more in the autism research, but working with the autistic community, I found out that quite a few were experiencing eating disorders, so it got me really interested in this area. And that's why I now work with Fiona and Kate. So I'm going to be talking about our workstream 2, which was using the photo voice. And what a photo voice is, it's about representing a narrative or a perspective using a photo or an image. And this could be a photo that you take or maybe a piece of artwork. And what it does is it's an inclusive method. So it allows people who maybe have alternative ways of communicating, like we see in a lot of our autistic people, they are still able to take part and not rely on that kind of vocal narrative to the same extent. So we had 14 participants take part in this, and it was a combination of some were online groups and we had one in-person group, and they were asked to take 3 images which best represented their answer to these 2 questions, which were, what is your experience of disordered eating, and what are the research priorities for autistic people with eating disorders? And we can see here in the left that this is an example of one of our participants' 3 images that they took. This person really liked using AI to generate their images, and they would have to pick one to specifically focus on for the session, because we had sometimes 4 or 5 people in the group, we couldn't talk about all the images, but everybody had to give their image a title and also a caption to explain what that image represents. And this one we can see here was called Spectrum City, and it was about representing that experience of going into a supermarket and just being bombarded, like that cognitive overload of just all this information. And they said about how it was like information speeding past them, lots of different colours going on, trying to process everything at once. So it's a really lovely symbol of that kind of cognitive overwhelm that a lot of our autistic participants talked about. So our first research question on the experience, this was kind of led by our researcher Kyle Buchan, and basically these were the kind of key themes that we found, and there was an overarching theme that kind of fed into all the other themes, and that was about autistic identity and how autistic people are really proud, rightly so, of being autistic, and they don't want to change that, but what they would like to change is obviously their eating disorder, but they felt as though their autistic identity kind of was driven through all the other themes and related to all the other experiences that were crucial and we need to consider this when we are thinking about eating disorders and how they are presenting in autistic people. So theme 1 was the overwhelm bucket, and this kind of covered both, so the example is Spectrum City that we seen in the previous slide. It also talked about how people were overwhelmed via their sensory processing as well, so just all the different sensations that are bombarding autistic people when it comes around eating and eating preparation. Theme 2 was diagnostic intersectionality, so we know that there was lots of co-occurring conditions in the autistic community, and that these also play a role in the experience of eating disorders in this group. Theme 3, go without me, the social consequences of eating disorders. So this was talking about how our autistic people were very conscious of how their behaviours impacted their families and their friends, to even the point where if their friends were going out to a restaurant, they would have to think about, okay, what can this person go to? What's okay for them? What can they have in the menu? And that this kind of starts this kind of cycle of guilt that they're doing this, and they get frustrated with themselves, but they can't help it. So they were really conscious of this playing a role as well, and being kind of a key issue with their experience of an eating disorder. And then finally, services and support. So we talked about how some eating disorders delivery services have kind of shortcomings or aren't accessible to autistic people, and that how just some adjustments, such as those highlighted already by the PEACE pathway, could make a world of difference to autistic people who have eating disorders being able to access support. Our next research question, which was to set out the research priorities, which was led by our postdoctoral researcher, Emmy Nimbley. And we came up with quite a few themes as well, quite similar to the experiences, because obviously autistic people were having these experiences and felt that research needed to focus on these aspects to better understand the autistic specific experience of eating disorders. And this included impact of early experiences, so that being born a neurominority within a neurotypical world is quite traumatic. So it's about understanding how these kind of early traumas can also influence under food and body image, and also eating disorders. The function of the eating disorder, so looking at eating disorder as a regulatory strategy and also as a social acceptance strategy. So we've been finding out lots about how masking is really associated with the eating disorder, and how that this may be a form of trying to fit in socially, and we need to do more research into this. Barriers and facilitators to eating disorder recovery. And it's about looking at autistic strengths, not only as barriers, but as strengths. We could be using autistic traits, especially that kind of, love of routine and predictability, and we can be utilising that to put in some healthy eating routines. So it's about better understanding how we can work with autistic strengths to do this. Then we have understanding and accommodating for complexity. So again, it's just that understanding of how co-occurring conditions, co-occurring even neurodivergence, as Kate already said, we have high levels of ADHD, in our autistic participants. So it's about understanding how these different neurodivergences can impact eating disorder presentation. And changing research culture. So they really welcome the inclusive and participatory nature of EDAC, and they want to see that across all eating disorder research as well, and better understanding support beyond the clinic. And these have also been published in the Journal of Clinical Psychology, the research priorities. Because, as you can see, the images are really, really powerful, actually, and you know, a picture can represent 1,000 words. We really wanted to kind of showcase the messages that our participants had shared with us. So we put on a photo voice exhibition. There's a QR code that you can scan to kind of see what this looks like online. And really this was to kind of, what was really powerful to us was when the autistic people were coming together, they were saying, I thought I was the only one. I thought I was the only autistic person who had an eating disorder. And it's so lovely to share this space with other autistic people who have eating disorders. So it was really kind of crucial for us to kind of send out this message to say you're not alone. There are lots of autistic people who have eating disorders, and it's about now the next steps in order to better understand what causes eating disorders for autistic people and what we can do to better support them. And then work stream 3 was all about taking the priorities outlined by the autistic people and doing some pilot work to see what was going on. And we were really proud to see that lots of our excellent early career researchers had came up with some pilot projects, and we had our autistic panel decide which ones EDAC would support to go forward. So we had one looking at mindful eating that was led by Phaedra Longhurst. We had another one on the body image project by Hannah, and we also had a citizen scientist, actually, so a member of the autistic community, just approach us and say, could EDAC support me in looking at peer support for autistic people with eating disorders and also parents of autistic people with eating disorders? And we were really happy to be able to support them in that. So and another stream that Fiona mentioned is our MRI stream. So that's led by our genius, Dr. Michelle Sader, who is a neuroscientist based in Aberdeen University. And she also had a project chosen by our autistic panel to look at via MRI methodology, and that was looking at masking in autistic people with eating disorders. So she's currently doing that. But she also got access to a Beacon dataset, which is an MRI dataset that was collected by Kate Tchanchuria's team, and able to do further research into that. And it was really interesting what she found. She basically found that for previous research, would always kind of argue that potentially autistic characteristics that you see in anorexic individuals are a result of starvation. And what Michelle's work showed was that actually the autistic characteristics were related to neurological underpinnings. So parts of the brain, specifically the middle frontal gyrus. So this kind of area was more related to autistic characteristics instead of being weight restored. So we've seen that when those who have anorexia nervosa had their weight restored, that this autistic characteristic still persisted, and that this is more related to a neurotype than starvation. So, and she's continuing to do this really interesting research into the neurological underpinnings. And I will take you back over to Fiona.
Okay. So then our last work stream was about all this great opportunity we've been able to do and to think about how to integrate this into clinical practice. So we took huge amounts of insight from the paper which Kate had talked about earlier in terms of thinking about how to implement elements of peace within clinical services and broaden that within NHS Lothian across both adult and CAMS services. And that included a seminar series with lived experience to increase confidence of clinicians in working with autistic individuals with eating disorders. We also developed a sensory audit of our environment, so which is freely available on the EDAC website, where you can go around your clinical environments to audit it and consider what adaptations need to be made to the environment. And also thinking about extending our traditional eating disorder assessment to include a kind of range of different factors which might be pertinent for autistic populations. We very much have now instigated and promoted autism screening at the point of a first assessment appointment for eating disorder services. And this is not about being diagnostic led. This is a population which doesn't do as well with our traditional eating disorder treatments. And the earlier that we know about some of these underlying traits, then the earlier we can make adaptations and make treatment more appropriate. So in terms of the next slide, Karri, in terms of, I think might be a couple to work through. Yep, the next one. So I suppose this came from a mixed method systematic review, which we managed to publish as well, which really did show, and this was Emmy Nimby, our postdoc, in terms of who led this, that actually autistic people and those with higher autistic traits do report poorer experiences of eating disorder treatment. And that while there's some similarities at the end of treatment around about eating disorder symptoms and BMI, those autistic people are more likely to end up with an inpatient admission and a prolonged inpatient treatment as well. So it just really highlights that actually we do need to also think about targeting some of our outpatient psychological therapies. And then the next slide, we're really delighted that we've also been doing a body of work, making our way through to some of those different first-line interventions, including family-based treatment for eating disorders. So we've conducted a whole range of different interviews with clinicians, young people and parents and carers, and so happy that the MRF have been able to fund the dissemination of some of this via change in policy and practice funding to develop an expert working group to think about some guidelines for clinicians and a series of webinar events starting next year to begin to think about what some of those adaptations might be. In terms of the next slide, the areas that we're thinking about going forward next is, as we said, the dissemination of those guidelines is our kind of big priority in terms of for the coming year. We're also beginning now to branch out as well to think about CBT for eating disorders as well and do a similar process for that. So that's available on our website if you want to have a look into that. And also thinking about how to make eating environments in general, including, for example, university canteens, far more neuro-inclusive, which is a project that Karri's working on. And finally, beginning to think about, we know that these adaptations are effective, and why are they not being implemented in every eating disorder service across the country? So we're doing just finished a series of interviews with clinicians, thinking about actually what's the barriers that get in the way with eating disorder services beginning to take on this approach, so we can do a more targeted approach about implementation as well. And then we've got a whole team of researchers in the background. I won't go into huge amounts, but are looking at a great variety of different research as well. So we're delighted that we're thriving at the moment, which is great. And thanks very much to as a result of the MRF funding. I think that was us for the end, but we're delighted, I think, to take some questions, I think, in terms of, and I think Kate was hoping to come back at this point too.
Thank you all very much. I'll just let Kate back on as well. Thank you, James. Thank you very much. That was really interesting. I would now encourage the audience to send in your questions on the Q&A. I forgot to mention at the beginning, the Q&A is open. Please use it and ask lots of questions of our experts whilst we've got them here. I'm going to take chair's privilege and kick off with one myself. So you talked about the confidence and competence of clinicians increasing by using the PEACE pathway, and it may be too early to tell yet, but I was wondering, have clinicians been seeing a difference, and have you been monitoring the difference in how treatment is working through the pathway, and can you tell us anything about that?
Shall I take this question? Yeah. Great question, Rebecca. Absolutely. Sometimes my team mates joke that I monitor everything under the sun, but this is how we generate evidence. So your question is absolutely valid. First of all, we, as I demonstrated, we have done series of the training events, and we measured multidisciplinary team competencies and confidences in beginning and in the end of 1 year series of the learning and teaching events. In addition to that, we just recently published the paper where we interviewed clinicians who were part of the PEACE pathway provision to gather the themes, how they found PEACE pathway helpful and how it made changes in their everyday practice. and evidence is overwhelming. And also what Fiona is planning to do as a next step will support this evidence. I'm pretty sure that we will find more informative ways to move forward with the training events and developing our clinical teams further. Does it answer your question?
Yes, thank you. Okay, so also, you talked right at the beginning about the fact that this has been rolled out internationally, and have there been any cultural differences in play for people from different countries who are both neurodivergent and have eating disorders? And have you been looking into those?
This is such an interesting question, and probably this will go back to funding issues because it needs to be specifically allocated time to research it. But anecdotal evidence is that many collaborators from different countries say that they are facing similar issues and there are more similarities than differences.
Okay.
So recently, for example, a clinical group with 30 Swedish clinicians and researchers visited us to take some of the learning experiences in their country, where they were funded very generously to implement peace pathway practice in their health system. We also know that there are some moves in Australia. They are doing fantastic work and implementing lots of peace pathway findings in their settings. Of course, all these national health services are very different. There are some guided principles which apply to all cultures.
Right, thank you. Right, so we're starting to get some questions in from the audience now. So Christiana says, thank you very much for this presentation. What do you think needs to be done more in terms of prevention of eating disorders in the neurodivergent community?
It's more for Fiona and Karri, I think.
I can take this one. Yeah, no, absolutely. And I think what's really important is actually we don't actually really fully understand the mechanisms at the moment in terms of why. Because if you look at it in terms of a blank page, in terms of someone with a diagnosis of autism would have lots of risk factors associated with developing an eating disorder. In terms of, we know, for example, that individuals who are quite detailed focused, as in terms of, or and a range of other factors, then are more at risk. But what's really interesting for me is that not every individual who is autistic has an eating disorder. And so we don't really know enough, I think, which is really important to be able to target in a really targeted way preventative interventions. What we do know and what is coming out though so far is the importance of early recognition of autism, which is incredibly important. And I think that is something that even without huge amounts of further research that can be done quite quickly. And I think it's particularly prevalent because a high percentage of individuals with eating disorders are female, and female are more likely to be missed with regards to autistic presentations as a result of their masking. But what we are getting is that people with a very late diagnosis, sometimes after they enter eating disorder services, who are very much saying it would have been so helpful to have had this understanding of myself earlier, to begin to think about why it is I'm experiencing these things, which might have prevented the eating disorder happening. I don't know if you'd agree, Karri, sorry.
Yeah, no, completely agree. We're still trying to understand those autism-specific mechanisms and what's common with neurotypicals as well, but what is autism-specific mechanisms contributing to eating disorders would be really invaluable. And what Kate and Fiona's already doing in services, I mean, by even assessing or checking for autistic traits early, you're never going to harm a neurotypical person, but putting certain adaptations in early could really prevent harm from being done to an autistic person with an eating disorder. So the work they're doing is great, and trying to deal with that while we're still understanding the contributing factors.
Great, thank you. Okay, another question from Jane. Do you work with other health professionals, for instance, dietitians, and is dentistry a particular complication for some people?
Absolutely. This all work we described is multidisciplinary. It involves not only dietitians, but nursing team, occupational therapists, and we are not the only ones. I'm sure it is the same in Fiona's and Karri's end.
And then
Sorry, dentistry is a really interesting one as well that actually we do probably need to branch out more to, both because some of the side effects of an eating disorder unfortunately mean that your teeth are at risk. But equally, I imagine the sensory experience of being in a dental surgery is hugely overwhelming. So I think there's a horrible bind, which actually would be really interesting to explore further.
Thank you. Okay, from Laura, the MRI scanning data was really interesting. Is it a standard measurement for those with eating disorders or just for the research projects?
No, do you know? Oh, sorry, on you go, Kate.
No, go ahead.
I was just going to say we were using it as a research methodology, and I think we were really keen, but obviously Kate can talk to other aspects of it, but for EDAC it was just a research methodology. But what was really interesting was when we were talking about the ethical complexities around MRI, autistic people were really, really interested actually in MRI scans, because I mean it's really cool to have a scan of your brain and how it works. So it's about kind of working with autistic people and understanding how they want their MRI scans to be used and utilised, whether it be for research, whether it be for clinical implications. But we're also really hoping to kind of understand as well that neurological level of these kind of key kind of factors that contribute to eating disorders within the autistic brain, and to move away from the autistic brain always being compared to a neurotypical brain, because that's no use to anybody. It's about the autistic healthy brain versus autistic brain of a person who also has an eating disorder, and start to understand what's going on at the neurological level. And Kate can come in with better info.
Well, the reason why we were lucky with the Medical Research Foundation, because I got funding several years back from Medical Research Council and Medical Research Foundation Trust jointly to support this fantastic work we started. We collected one of the biggest data set in eating disorders, in young people, and because I already had interest in autism and neurodivergent conditions, we included in the study people who had autism, and certainly we included measures of screeners for autism. Now, this gave us unique opportunity to build on this research project. Unfortunately, answering your question, scanning is not routine assessment. It's very expensive. Just to give you an idea, each scan costs 500 to 650 pounds for an hour. And I was very much worried. It was huge responsibility to take this massive project and do scans one time. But I must say that disorder community as well as neurodivergent community came back even for scans. And they were much more interested than our healthy volunteers, because we lost half of the data, but lived experience people kept longitudinal aspect of the study, and we have unique data set, and that's why Michelle is going back to the data, reanalyzing. So basically it's thanks to the research, because it's so expensive. But having said that, Medical Research Council and Medical Research Foundation were extremely generous and thoughtful to support this research initiatives. And although it is very expensive, we are trying to maximize and utilize our existing data sets and add more and more questions, more and more data to use this resource wisely. So more to come, but it is unfortunate we can't stand everybody who wants to get their brain pictures, because our patients loved it to receive what their brain looks like and to talk to us about the results.
Well, that's fantastic that you've got such rich data sets. Okay, so Amanda says, I have been offering nature-based therapy and cognitive analytic therapy, relational, to young people with both neurodiversity and eating disorders in my NHS role with good outcomes. Is there any support for these approaches in your work or any similar initiatives for elsewhere for collaboration?
I mean, I can say that we have cognitive analytic approach in our outpatient setting. It has really good results, but again, we don't have that much evidence-based randomized treatment trials or anything like this. But gut feeling is that it works very well for some people. Regarding nature, I think this does not even need evidence generating. It is fantastic resource and we need to capitalize on it. We know that neurotypical as well as neurodivergent community benefits from nature, gardening, everything to do with this ecological friendly well-being, wellness practices, and that's no-brainer, really.
Yeah, thank you. So I think we have time for one more question. James, let me know if we haven't not time for another, but I think this needs to be the last one, which is a shame because we've got lots of questions in. Helen has said, I'm very interested in the use of photo voice and wonder if you have used any other creative methods to understand the autistic experience. As an artist undertaking a practice-based PhD investigating the role of storytelling in articulating my experience as a late diagnosed autistic individual who had been diagnosed with anorexia nervosa over 25 years ago, I use various creative methods to do this, journaling, creative writing, and so on.
So I think obviously photo voice is just one medium, and it's so nice to hear that, you know, other creative methods. We do have Luca White, who is a PhD student of mine and Fiona's, who's keen to look at journaling in the trans and non-binary autistic community who also have eating disorders. So we are looking at other methods as well. And you're so right, like the images and art's only one way to be creative, and we have to be tapping into these other creative ways just because we do have so many of the autistic community who use alternative communication. So we need to be ensuring that we don't just always rely on the verbal spoken word to try and capture these experiences. We need to also capture these other underrepresented groups' experiences as well. So, and it's great to hear that this is welcomed and there is other stuff going on that's tapping into that kind of creativity.
I will add that we used very successfully artificial intelligence generated images and metaphors to give language to people who can't express their feelings, and it was really successful, especially with neurodivergent community. We produced paper which is on the PEACE website.
Right, thank you. And then we've got a question around which I'm going to paraphrase, but essentially it's around the National Child Measurement Scheme and whether that has an impact on people with autism, where, you know, being told that you're under or overweight at a specific age, and how that feels and how it's interpreted. Do you know anything about how that interacts with autism and eating disorders and so on?
No, I think the answer is we don't know exactly in terms of I think that certainly from my clinical experience, sometimes what I have is young people who have had quite black and white messages, sometimes within, for example, health education within school, or around about their body in terms of good or bad foods and things, which actually, as a result of that kind of autistic brain, have interpreted in a very black and white way and has become quite rule bound. So I think it's an area which really does warrant further investigation, because I suppose any kind of public health process should also be looking at potential harms as well in terms of, so it's kind of weighing up those as well too. Yeah.
Great, thank you. Okay, we're going to have to wrap it up there. A huge thank you to Kate, Karri and Fiona. Thank you so much for coming on to talk about your research. Thank you to the audience for attending, for joining us to hear about life-changing research. If you'd like to learn more about the work of the Foundation and the researchers we support and how you could support us to support them, please visit our website. Research like this gets funded because of generous donations from members of the public, including many of you who are tuning in today. If you wish to make your own contribution to funding life-changing research, please consider making a donation to the Foundation. Thank you all for your support. We will be emailing out a recording of this session over the next few days. We'll also put it on LinkedIn and other social media so you can share it or watch it back. And we'd be grateful for feedback at that stage as well if you have it. I really hope you enjoyed this seminar. Thanks very much for attending.